As the government rushes to ensure Kenya is fully prepared for a possible outbreak of the coronavirus COVID-19, 14 counties have been identified as being at high risk in the event of an outbreak.
Case fatality rate is very high.
Speaking at the United Nations complex in Gigiri during a forum of Kenya's preparedness, the head of disease surveillance, Dr. Daniel Langat, listed the 14 counties, which include Nairobi, Mombasa, Kisumu, Kiambu, Uasin Gishu and Kajiado, among others. These areas have been mapped out based on, among other factors, their high population of Chinese nationals as well as presence of international airports.
Kiambu because of its closeness with Nairobi, Kajiado as well. We have Nakuru because that is a major highway, connecting the western part of Kenya all the way to Uganda from Mombasa.
Kenya remains at high risk of an outbreak due to various reasons, including
the fact that we have a huge number of Chinese nationals in this country doing various activities, mainly in the construction area. And of course now, what our colleague has mentioned, our socio-cultural practices. We like shaking hands. We've seen in videos, YouTube, what the other countries are doing now. No more shaking hands. And now using their feet for greetings and the rest. The other one, of course, is we know Mombasa is one of the major seaports in the region. So that is one area that could also pose a threat in terms of importation of any cases.
The Ministry of Health says it has so far handled 21 alerts of the virus, but revealed that only 9 of the cases met the standard case definition for a suspected COVID-19 case. A person is only identified as a standard case definition after either exhibiting signs and symptoms of coronavirus, having had a travel history to one of the affected countries, or having come into contact with an infected person. So far, 87 countries have been affected, with the death toll now at 3,308. 96,612 global cases of the virus have been recorded, with South Africa reporting its first case Thursday. South Africa becomes the 8th country in Africa to have confirmed cases of COVID-19. The patient in South Africa, a 38-year-old man, exhibited symptoms of fever, headache, sore throat and cough, having returned from Italy. The Ministry of Health is set to officially launch an isolation center at Mbagathi Hospital tomorrow in compliance with an executive order by President Uhuru Kenyatta. Gloria Milimu, K24 Evening Edition.